it's flu season, and we had a couple of questions that came in about antibiotics and things like that. Somebody wrote in and said, my son had a sore throat with a rash and very goopy eyes. We did an amoxicillin antibiotic with clava something in it. He got better, but then he started having cramps in his low belly. Now he's on a Z-Pack, and I'm giving him a probiotic. Still, he's coughing. What can I do to get him all the way well? Is this unusual to be on more than one antibiotic?
No, not necessarily. And I don't know if this question relates to another question you're going to be sharing.
It isn't. I know that they're from different viewers, but I know that there is a component that's related, yes, but they're from different viewers.
Okay, that's helpful for me to know. Well, because there was a rash, and maybe depending on what they heard in his lungs, it sounds like his doctor felt there was a bacterial component, and that's why antibiotics were just prescribed. Antibiotics only work on bacteria. They don't work on viruses. And the amoxicillin with clavulinate, that's the same thing as augmentin. Augmentin is a powerful penicillin. It's more powerful than amoxicillin because the clavulinate, the bacteria aren't as resistant to it. So he got better, but augmentin is known to be very hard on the GI tract. It's not unusual to get low belly cramps from it. So the probiotic can help in healing that. But if he wasn't entirely better, if his lungs didn't get clear, it may have been that augmentin was not the right choice. So the Z-Pack, which is azithromycin or Zithromax, that covers a different range of bacteria and germs than augmentin that can also infect the lungs. So periodically, if the person is not well enough, there's still fluid and congestion in the lungs, a second antibiotic needs to be used.
Okay, good to know. Now our next question, which could have been related, but I happen to know they're from different viewers. It seems like doctors in emergency rooms don't want to treat our kids. My 18-year-old son was so sick. We went to the ER, and they basically sent us home and told us to finish the antibiotic that he's on. My friend's son, same age, went to the same ER and was given an IV, a steroid shot, and they changed his antibiotic. He's all better, and my kid is still struggling to get better. What can I say in the ER to get them to treat my kid? And there's 3 question marks, so I think there's a level of frustration. And this isn't the first time, and I've experienced some of this myself, where if I tell them that my son is on the autism spectrum, they back up and they treat less. What advice do you have for us, Dr. Copeland, to talk to those doctors so that we don't get less treatment?
Okay. It's a tricky question, and I'm not sure I have an easy answer. And perhaps one of the concerns with the ER doctors is it's kind of known that individuals on the autism spectrum may be more sensitive to medications, and I'm not sure if that entered into it at all. But also well, first of all, I want to empathize with the parents' frustration that, of course, they want their son to get better, and the sooner the better, because it's no fun suffering through an illness and wondering, is it appropriately treated and when will they be better? But in fact, I don't know offhand whether, the ER might have done the appropriate thing for him. And I know this person is comparing the treatment of their 18-year-old son with the treatment of a friend's 18-year-old son that on the surface may have seemed to have similar illnesses. Maybe they both had bad coughs. But without knowing the detail, it's hard to know why the ER did one thing in one situation and a different thing in another. But there's plausible reasons why the boys might have needed different treatment. And just sadly, even despite antibiotics that are successfully treating a bacterial respiratory infection, some of those respiratory infections just last longer than others. And even though the bacteria are going away and the infection is starting to heal, the irritation in the airways can last longer. And so you still feel miserable and you're still coughing a lot, even though you're on the right treatment. That can happen. And as an example, kind of comparing why would you give one 18-year-old just say, stay on the same antibiotic, and why do you do more for another 18-year-old, like a steroid shot and an IV? Well, there's lots of different reasons that could have happened and could have been good care. The steroid shots aren't usually given just for a bacterial respiratory infection per se. They're usually given when there's swelling in the airways such that that person is not moving air in or out well, as in an asthma attack or other, serious swelling in the airways. You wouldn't do it just for any case of bacterial pneumonia, give a steroid shot. You'd only do it if there was swelling in the airways, preventing the airflow. And similarly, you don't necessarily want to do an invasive treatment like intravenous treatment if it's not needed. It hurts, it's painful and whatnot. But say that both boys had some vomiting. Well, one boy may have vomiting because they're coughing so hard, they gag, and then they throw up intermittently, but they're able to drink fluids, and they're getting enough fluids down, and their hydration is okay. Another boy might be vomiting so hard they can't keep any liquids down, and now they're dehydrated. Well, it would make sense in the one case to start an IV and give some IV fluids for the boy who can't keep anything down. But you wouldn't want to do that for the boy who's just vomiting from gagging on their cough, but is otherwise drinking fluids okay. So it's really hard to compare, the two cases. But when in doubt, because we don't expect parents to be medical providers, if you think there may not have been adequate treatment and or it seems like your child's slow to recover, that's where, like you said, Shannon, you have a pediatrician who's really good and you can really trust. So you and the pediatrician know your son much better than an ER doctor. That's where it's good to just touch base with the child's primary care doctor and say, is this adequate treatment? Why is it taking longer to get better? Is this just a matter of time that we need some more time and supportive care, like natural decongestant with chicken soup, if you can tolerate that, or herbal teas? Or could something have been missed? Is different treatment needed? Did I explain that well? Does that
actually, I think you explained it really great, because I'll tell you what I heard is that, a lot of times as autism parents, it's so hard not to judge everything and go, well, is my child in every circumstance, is the teacher being this way with them because they have autism? We're constantly, is my child doing this? We're comparing constantly. Mm-hmm. And a lot of times we jump to the conclusion that when somebody treats our child differently, that it's because they have autism, and sometimes it's not. So yes, I loved hearing that, we have to take those other things into consideration, but I also love that you empowered us that if we feel like it's not happening, that we do have other avenues, and that the ER may not be the best one. And I think I think that it helps us all to expand our brains a little bit, which is probably, as you were talking about it, I was thinking, we were all sick over the holiday break, my husband, my son, and I, and we all got treated differently. And our symptoms were slightly differently. I mean, my husband ended up with an inhaler, I did not. And, so even, and in our case, we saw the same doctor. So it is possible that everybody needed to be treated differently, and it's important for us to remember that. So I loved your answer.
Thank you.
I'm going to move on to a question. Somebody wrote in and said, what can I do to help my daughter with her menstrual cramps? And they said, this is new territory, help.
Yeah, it's a huge question.
Yeah.
It's a huge question for all young women because significant menstrual cramps are fairly common and, can be especially tricky in young women with autism spectrum.
Yes.
So definitely there are some home remedies that can help, like at the time of the cramping, applying heat, taking a warm bath, A warm pad on the belly might offer a little relief. Trying to keep regular exercise all throughout the month, and even including during the menstrual period, some gentle yoga stretching and whatnot can be helpful. And there are some natural food remedies and herbal remedies that could be considered. I like to go to trusted websites discussing different treatment options. And one website I really like is from the Mayo Clinic. So they review some potential remedies. And another that I think is pretty good that focuses on alternative home remedies, it's called, I've got it somewhere, the top 10 home remedies. So www.top10homeremedies.com, all one word. And then if you look up the home remedies for menstrual cramps, they present some good scientific information on some natural dietary things and herbal and tea treatments that may be helpful. And there's a whole list of them to consider. So it may be finding out what works for the young woman. So you can make tea of ginger, of basil, of cinnamon, just a small amount of cinnamon and like a quarter teaspoon and a cup of hot water, fennel. You could do black strap molasses in warm almond milk if they can't be on regular milk because of the casein. Chamomile tea. You could try to eat 2 tablespoons of flaxseed daily, all month long, but especially in the days before your period and during the period. And the flaxseed you can sprinkle on your cereal or yogurt or salad or put into a smoothie. And then papaya. And what all of these ingredients have is they have different kinds of nutrients, but all the nutrients tend to relax uterine muscle because it's the really tense contractions of the uterine muscle that cause the release of substances called prostaglandins that contribute to the definite pain and kind of inflammation that goes along with it. So I would refer people to those websites to, learn, like for chamomile tea, you want to steep it long, 10, 15 minutes to get a fair amount. Same with the ginger and basil, they give the actual recipes for how much. And pycnogenol from pine bark actually has a phytoestrogen in it, may be helpful. And then you could also consider pain relievers over the counter if your child can tolerate them, such as Motrin, which is ibuprofen, and Aleve, which is naproxen. They're what we call nonsteroidal anti-inflammatories. The thing is, not all children on the autism spectrum tolerate those kind of pain relievers. If they don't tolerate the Motrin, they might tolerate Tylenol, which is acetaminophen. But there is one theory in terms of detoxification that perhaps some individuals on the autism spectrum don't detoxify Tylenol very well. So you have to kind of use your own judgment and knowledge of your child if you use the over-the-counters. And then there are some prescription pain medications the doctor can give, like Ponstel. If you tried all these natural remedies and the pain relief is not enough, sometimes a prescription will help. And it also, if you've done everything you could and they're really severe, kind of disabling cramps, you'd want to check with the doctor to make sure there isn't a medical condition going on. I've even seen very young teenage women around 16 actually have endometriosis throughout their abdominal cavity, and that needs to be diagnosed and treated by a gynecologist.
Wonderful. A lot of information there. It also, as I'm sitting here with my cinnamon and cardamom tea on the desk here, it's Celestial Organics. So all that tea sounded really wonderful. And there are some that if you go to a specialty store that are already many of the things that you've mixed together so you don't have to make your own tea. I'm not that enterprising. But as you were talking, I thought, oh, it's so funny because when I was a teenager, I'm of a significant age, and I remember all the girls were starting to take over-the-counter medicines for menstrual cramps. And, you know, people were trading that medicine around my junior high and high school like crazy. And a lot of it has caffeine in it. And I remember people getting sick on it. I was always so angry because my mother would hand my sister and I a hot water bottle and say, go put this on your stomach. It actually helped. And now you don't have to have a hot water bottle. They have those gel packs and other natural packs that you stick in the microwave and then put them on, and they feel great. And I thought she was so backward and behind the time, but I watched girls get sick on some of those caffeine medicines.
Their Midol.
Oh yeah, and that's like, you know, not a great thing for a lot of our kids who are on the autism spectrum. So
yeah. And there's a new technological invention called a TENS unit, which is a transcutaneous electrical unit, which used to only be available by prescription and used to be extremely expensive. But now they make units for home. And it's just two little electrode patches you put on your skin, and it gives a gentle current that almost feels like a massage, and it can help muscle, you know, skeletal muscle cramps and pain too, but it can give some relief if you put it on your belly.
There you go. Great advice. But this question says, this question is for Dr. Copeland. I hope she can help me. Recently, I've noticed that my son's urine is very bubbly, foamy. There are no chemicals in the toilet to make the bubbles, so it's definitely the urine. Also, it's more in the morning than later in the day. I did a urine dipstick test and it showed increased SG. When I spoke to the doctor, she said it's nothing to worry about, but obviously I'm still concerned. Thank you for an amazing show and an opportunity for us parents to be heard, and they said lots of love. What do you think, Dr. Copeland?
Oh, okay. As far as the bubbling and the foam, I think I would agree with the doctor. It's less concern if it's in the toilet, even if it's coming from the urine striking the toilet, than if it were at the tip of the urethra. So for a male, if they sense that air was coming out right at the tip of their penis along with the urine, that would be abnormal and could suggest a medical fistula between part of the GI tract, which does have air in it, and the urinary tract, which should have no air in it. Okay. So if the bubbles in the foam are right at the tip of the penis at the opening, that's abnormal. As far as the bubbles and foam in the toilet, on the dipstick, the mom mentioned that there was high SG. High SG stands for specific gravity. And that is the density of the urine, like how many chemical particles have the kidneys filtered out and put into the urine and made the urine concentrated. So a high specific gravity means that urine is very, very concentrated, and which means it would be heavier. And also depending on the force with which the individual is urinating into the toilet, both of those could kind of explain the more of the bubbling phenomenon. But it also suggests the person may not be drinking enough water, that they actually need to get more fluids, drink more water, especially during the day, so the urine isn't so concentrated. But it's not, I agree with the doctor, it's not a serious medical concern, but the mom's paying attention and thinking about it and asking good questions.
Okay, we love all of your answers to everything. Thank you so much for being with us, Dr. Copeland. We will be talking with you again in February, and the first two questions we'll take are the ones about the glutamate and the question that we had somebody come in about, question about GI tract and some of the different things that they're doing and how it can heal.